Hey YouTube, this is Cindy, Passion One again. I think this might be the last video I upload today. Today is Thursday, February the 16th, and as I may have mentioned in some of my videos, that yesterday was my last chemotherapy session. So this is just like my breast cancer chemo update video, and I'm just gonna put out here what I went throughout my journey, in case somebody else may need this for educational purposes. When I was first diagnosed, I got a lot of information online, but I did not see a lot of African American women telling their stories, being open and honest. And that's what I want to do with people that feel like they can relate to me. I might say something that can help you on your journey, or any woman that's going through this or has any form of breast cancer or anything. Okay, long story short, when I first went to my first visit with my oncologist, they gave me this book, and they also gave me another folder, but they gave me this book, and the book is called C101 Cancer 101, Basic for the Diagnosed, and it has several different areas in it. It says My Cancer 101. It has a notes section. It has a 1-year calendar planner. It has a 10-year follow-up calendar planner. It has an address book. It has a place where you could put the business cards for your doctors. It has medical history and appointment tracker, symptoms tracker, medical bills and insurance tracker, helpful advice for people with cancer and their caregivers, questions to ask your doctors by cancer.net. That's a line that you go on, an online site that you go on, and they have questions on everything from medications to side effects to anything you can think of. Dictionary of cancer terms. What is a clinical trial by the Correlation of Cancer Cooperative Groups, and it has becoming a C101 life saver. Let's see. Before I get into my story, let me see something real quick. Well, what I was looking for is not in there. But let me go to my calendar so I can sort of kind of keep up to date on what's been going on. As you may or may not know, I was diagnosed on August 25th, 2011. My general practitioner had scheduled me for my yearly mammogram, and I went, and they called me back and told me they needed me to come back in and have another look. And I wasn't surprised, because I'm 44 years old, and every time I do a mammogram, they tell me to come back in, and then they say, oh, it's okay, it's calcification and stuff like that. The last time, honestly, that I went in for a mammogram, and I went in and they saw a spot that looked suspicious, and she told me to come back in 6 weeks. 6 months. I did not go back 6 months. I didn't even go back 1 year, 2 years, or 3 years. I went back this year because my general practitioner now is not having it. So I was not surprised. I don't think I was as surprised as I could have been when I got the diagnosis. How I got the diagnosis was from, okay, I had a mammogram. I went back, I had a second mammogram with the ultrasound. After the mammogram with the ultrasound, I had a biopsy. After the biopsy, I had a MRI. And that's when we started to talk about surgery. Actually, before my MRI. Because the medical center that I was going to at the time, the doctor that's affiliated with that, he said he wanted to do a lumpectomy on my right breast. But personally, I know what I want, and I've always told myself if I was ever diagnosed with breast cancer, I always wanted to have a mastectomy on both breasts. But I didn't do that this time because later on I found out how you may not have any sensation in your breast, or it might take a long time to get sensation back. And when it comes to being intimate, I would rather be able to have sensation on one breast than on both, no sensation on both breasts. So I decided just to do the one breast. But I knew I wanted to do immediate reconstruction. And because I was going to a medical center, they do not have plastic surgeons. They would have to call a plastic surgeon for another hospital, and she would come do it on a case-by-case basis. Well, if they're not used to doing this procedure, I knew that the staff, I am an LPN, so I knew that the staff would not know how to take care of me. And that was just too dangerous of a risk to take for me. So, being a lap band patient, my lap band doctors are also have a team of oncologists and general surgeons for cancer and all this. So I decided to go back there for a second opinion. And when I went back there, I was referred to a doctor named Dr. Carmody. He works with Richmond Commonwealth Surgeons at St. Mary, and he is wonderful. I took all of my paperwork and reports from the previous doctor to Dr. Carmody, and he talked to me like I had never seen another doctor before. He gave me all the information that I needed. He gave me copies of everything, all my lab work, all the results. They would tell me, the size of the biopsy, what it was, and everything. So I was really, really impressed because the other doctor, he was not giving me what I felt like I needed. And, being in the medical field, I would ask certain questions, and I don't know if he was intimidated, but between what knowledge I have of cancer from being an LPN and what I had learned on the internet, it just wasn't jiving. So I told Dr. Carmody I would love for him to perform my mastectomy, but I wanted an immediate reconstruction, and I wanted a tram flap or a deep flap. I really wanted a deep flap, and he referred me to one of his colleagues. I don't think his colleague does the deep flap, but I'm happy with the tram flap that I got. He talked to me about the tram flap. He talked to me about breast implants. He took pictures. He took measurements. And he said I would qualify for both. But because I'm a lap band patient and I was in the process of saving money for a tummy tuck, I was like, well, hell, if I can get tummy tuck for free while I'm getting my breasts done, that's what I'm going to do. So that's what I decided to do. So the next thing we had to do is get insurance from approval from the insurance company, and it was approved. And then we had to get a schedule where Dr. Carmody and Dr. Hubert could work together and schedule a date. It took Dr. Carmody about 2 to 2.5 hours to do his section, and then like the last hour of him doing the mastectomy, Dr. Hubert came in and started to do the tram flap. Both of them marked me before I went in. Dr. Carmody, which did the mastectomy, he just initialed my breast so he would know what breast it was. Dr. Hubert did all of the initial marks because he was doing the most work. So Dr. Hubert put on me where he needed Dr. Carmody to cut on my breast, and then he did everything else. Okay, so when I went into surgery, I was in surgery for about 9 hours, and during the procedure, they took all of my breast tissue out. You've seen pictures of a tummy tuck or a video of a tummy tuck if you haven't looked it up. Or better yet, go on YouTube or Google and Google tram flap, and that'll give you a picture of what I had done. But basically, long story short, they took the fat from my stomach and made a tunnel up my chest and left a muscle attached for blood supply and made me a new breast out of that. I was in surgery for like 9.5 hours. From 1 o'clock, when I got back in the room, I think it was like 11:30 at night. And I was a little groggy. My mom and my boyfriend were still in the room. And I knew I was going to go to sleep, so I told them, I'm okay, just leave and go home. Well, about 2 o'clock, I had a drain in my right breast, and I had 2 drains in my pubic area from the tummy tuck. The drain in my right breast was draining too much blood too fast. The girl would drain the blood in the cup, dark red blood, and go dump the blood and measure it. Well, by the time that she got back, it was full again. She didn't like it. She called the surgeon. I was rushed back to surgery. He opened my breast back up. I had formed a hematoma. He cleaned it out and did whatever he had to do, and I think about 4:30, 5 o'clock, I was back in my room. I really was not in a lot of pain. I was on a morphine pump, and I had a on-cue ball in my chest, like right between my breasts, to help control the pain. I think I was on a morphine pump for like 2 days, and then they put me on Percocet, and I was on that. I did get up and go to the restroom with assistance. What else happened in surgery? I was in the hospital for about 5 days, and then I came to my parents' house, and I did fine. My stepmom was my caregiver, and she did an excellent job because I couldn't wash. I can wash my private area, but up under the breast and the stomach, she did all my drains. She did all my gauze and lotioned me down and everything. She was excellent. She did my meals, 3 meals a day. She did my laundry. I think I stayed with her for like 2 or 3 weeks after surgery. Excellent, excellent, excellent. I don't know what I would have done without her. So thank you to you, Francis. Love you. Okay. So then the next thing is, since I was this triple negative, whatever, and all my cancer was removed actually during surgery, but me and my oncologist, which is Dr. Susan Schaefer from Oncology Associates. I want to say that's where she is. I'm going to tell you the truth, because if any of you live in Virginia, she is great. Dr. Susan Schaefer, she's at Bon Secours Cancer Institute, and she's my age. She's 40 years old. She's a perky blonde, full of energy, and she's nice. But me and her decided that we would do 4 sessions of chemo in case any other cancer cells broke off in my body. We can target those, and it would give me a little bit more of an insurance policy. So on December the 2nd, I had my chemo port put in on my left side because I had my breast cancer surgery on my right side, and they don't want me to have anything done on my right side. No blood draws, no blood pressures. I have for life. I have to be very careful about mosquito bites, scratches, no razors under my arm, nothing, because this arm can get affected very well. When they did my surgery, they also took 4 lymph nodes out of my armpit. So I forgot to tell you about that, but they did. Okay, so December the 2nd, I had my port put in, and my first chemo appointment was December the 9th. That did not go well. They inserted the needle into my port, and they could not flush it. They could not get blood return. They said the port was flipped. They tried to do everything. They sucked me about 4 times. Then they sent me over to radiology, and they wanted to inject dye to see what was going on. So what we found out is my port was kinked in 4 places. It was like a cursive M in my neck. So on December the 13th, I had my port taken out of my left side, and I had one put in my right side. And the 14th, I had chemo 1 again, because the first one didn't take. And the chemo went fine. It was sore because I had just got my port in, but it was fine. I was on Cytoxin and I cannot remember, Toxamir, something like that. They call it CT. I only got 2 chemo drugs, but I also got Pepsid for my stomach, so I wouldn't get upset. I got Benadryl. I got dexamethasone. I take that pill the day before chemo, the day of chemo, and the day after chemo. That is a steroid. Helps to gain weight, believe me, I know. And something else. When you go in, they'll first give you like a little bit of normal saline for hydration. They'll let that run. They'll do your vital signs. They'll insert your needle in your port. They'll draw a tube of blood and they throw that out. Then they draw another tube of blood, and whatever orders you have written for your labs, they'll send them to the labs. And it takes the lab about 45 minutes to an hour to send back your results. If your white cells are back up and your CBC and I think your CMP is good, the pharmacy mixes your medication right then, and then they send it over. So while all that's going on, you're getting all these other drugs run that I just mentioned. So each bag hangs for about an hour, and then they flush it and they let a little bit of the hydration go through, and they give you your other bag for an hour, and they take another set of vitals and they flush it, and you normally go. My chemo sessions normally last about 5 to 6 hours, and I just lay in the bed and watch TV and mess on my computer, or whatever. But they're so nice there. It's plenty to keep you busy. Okay, so let me tell you what goes on after you do your chemo. Okay, I had my chemo on the 14th. I really didn't have an appetite. I felt good the 15th, okay the 16th, okay the 17th. On the 18th, I got really, really tired. I was tired the 18th and all day the 19th. On the 20th, I had a awesome headache. And I took my blood pressure and it was okay, but my pulse was like up to 105. And my tongue started feeling sort of weird. Well, the steroid that I take gives you a headache. And it also was the cause of my pulse being up. So some other things you have to look out for is that anything with a mucous membrane, like your eyes, your nose, your mouth, your vaginal area, gets really tender. Your eyes run, you have vision changes, blurry vision, your tongue gets sore, your throat gets sore, you get little blisters in your mouth. But they have medication to counteract all this. Sometimes with your vaginal area, it doesn't itch, but it feels different. And you have to be careful when you have sex, if you have sex. Okay, so then I go see my doctor on the 27th, and I had noticed by then my hair had started to shed a little bit. Okay, I had chemo again on January the 4th, and the 5th, 6th, and 7th, I had what they call chemo coma. I was in bed literally for 3 days straight. I got up, I had a drink of water, fixed me something minimum to eat, and then just slept. By Sunday, my mom called me and told me to get up. Come over her house for dinner. Just get up. Well, after that, okay, the 9th and the 10th, and I was okay. The 11th, I got tired, and it wasn't like the chemo coma. It was like I got up, started doing some work during the day, and then started doing some work during the day. After 4 hours, I got tired, so then I laid down again. And the rest of that month, I felt okay. On the 16th, I started to get a sore throat, and I was tired on the 16th and the 17th. I went back to chemo on the 25th. That day, I went by myself because I just felt like being alone. My chemo session went fine. I think the only chemo coma day I had was that Friday or that Saturday. I just slept all day. I think it was that Friday. And I went back to my chemo doctor just for an update on the 31st. Well, when I went to my chemo on the 14th, on the 4th, I had shaved all my hair off because it got to the point it was on my pillow. And then if I just do like this, it just all came out. And one morning I woke up and I literally looked like a cancer patient. So much of my hair had rubbed out on the pillow. You could see my scalp through my little fro. So I didn't want to look like that. So I just cut my hair off, and I started wearing wraps and wigs, wraps and little hats. But this is a lace front wig that I had got, and I've just been wearing this for the last 2 weeks. Okay, so then I've been feeling okay, and I went to chemo yesterday, and yesterday was my last session, and it went well. I did not feel when she put the needle in. I did not feel when she took the needle out. I took my sister with me. As some of you know, I lost my biological mother when I was 17 to lung cancer, and my sister had been really distant from me ever since I had this surgery because she was so young. She was 7 when my mom died, and she had such terrible images of going to the hospital, seeing her with tubes coming out her lungs, and just, and she didn't come visit me when I was in the hospital at all. But I told her, Stacy, I am the only sister that you have left now since Tina passed away almost 2 years ago. And I really would like you to share this experience with me, because you never know if you have to go through it, if your daughter has to go through it. And you need to be prepared for things in life, and use me as a learning tool. And she went, and she was happy that she went, and we had a great time at Chemo. So one thing I want to show you guys is one of the side effects from the medicine. I don't know if you can see how dark my fingernail is. My fingernails have gotten real dark at the base, and they say it comes from when the cells break down and regenerate. And they say about at the same time when my hair starts to grow back, my nails will, the color will come back. I've heard some people have lost their nails, and I hope I don't. But in the skin around your nails, it's really dry, not only from the medication, but also because you have to constantly wash your hands. So you have to keep your hands and your feet very well moisturized. I suggest using something like shea butter or Vaseline. But I just want to come over here. I know this is a long video, but I think it will be helpful to somebody that has gone through this journey or has to go through this journey. I just wanted to be here for somebody and let them know what I've went through. If you have any questions, if something I didn't mention and you want to inbox me or put a comment, feel free. But this, I have one more appointment with my oncologist, my general surgeon, and my plastic surgeon, and I'll update you on that. And then after that, hopefully that will be the end of this chapter in my life. Bye. Thank you for watching. I know it's a long video, but smooches.